Hello everyone, welcome to Manika IAS. Welcome to the daily news analysis session presented to you by Manika IAS. Before we proceed further with the discussion, let us first see the topics that we'll be discussing today as per the Hindu. So these are the four topics, these are the four major topics that were covered in today's newspaper. So we'll be looking forward to it. Before we proceed, there were students who were asking they are not able to cover the entire newspaper on daily basis because it's a hectic task to cover. Sometimes the number of articles are less in the newspaper to cover, that way it is easier for them to cover. However, there are certain time when the number of articles are more. So what you can do during those time, since you have very limited time of preparation, first, you can follow your newspaper post the discussion. Second, you can skip the articles that you have been seeing on regular basis. Say for example, if the issue was with respect to Red Sea, and we have seen that over a period of like 1.5 months, on a regular interval there were articles related to Red Sea news. So you can skip the editorial surrounding that on that particular day, because somehow that will be covered either in videos or in some other day in some other editorial. Okay. However, the articles which are appearing for once in a while, you ensure that you cover those articles. Okay, because that will give you very useful insights. So skip the repeated articles over the one who are occurring for the rare time. Okay. So these are the four topics that we'll be covering. One is sanitation in India. Here we'll be discussing about the coverage and the reasons behind behavioral change, or if not, then why. Okay. Then we'll also be discussing about this Uttar Pradesh model to tackle malnutrition. So I must tell you here that all these three articles are relatively important for your mains examinations. Only this one is important, and that too some factual information part of it for your prelims. However, these three are very beautiful articles to cover certain topics in your exam. Here we'll be talking about addressing malnutrition. How Uttar Pradesh was able to address the challenge of malnutrition in a very beautiful way. This is an extremely beautiful article and very good for your essay writing and your answer writing in your mains examination. Then Indian democracy in 2047. After 100 years, our vision is Viksit Bharat. As we discussed when we were discussing our budget. Okay, and if any of you have not seen the budget, it's very important document, and do see the budget videos that we have discussed in the past few days. Okay, and in the past few days even the newspapers were full of information regarding the budget, the analysis part of the budget. So please ensure that you are watching those videos. They'll give you a very beautiful insight with respect to the policy and program of the government, as well as a good content for your mains examination. Okay, the PDF is also available on the website and the videos are available. The link will be given in the description box, and somewhere here also you will find the link on the top end corner. Okay, so this is here we'll be discussing about healthcare. What are the opportunities and challenges given to us by our healthcare sector if we want to achieve the target of Viksit Bharat by 2047, that is 100 years of independence. So let's move to the very first topic, which is sanitation. Okay. See, sanitation, as we all know, health and hygiene are extremely interlinked and important, specifically with respect to India, because it is a very overpopulated country and we do face a problem of sewage issues, discharge of waste, that is also garbage issues, so pollution. So these are the challenges which are there with respect to India. So sanitation is very important, and the landmark policy of government is Swachh Bharat Abhiyan. Since 2014 the government has came. Since then they have launched the Swachh Bharat Abhiyan and it has been successful. Then you have ODF plus. Swachh Bharat Abhiyan, Gramin Yojana. So all these are flagship program of this government, and hence they are very extremely important for your mains examination in terms of your answer writing. You can also get a standalone question on these schemes. Also, it is important for you prelims also to know what the scheme is all about and what are the targets of different schemes. Okay, so that is where the relevance of this articles comes in. So shall be discussing about the global commitment. If you see the sanitation, what is the global commitment? Sustainable Development Goal 6, which is to be achieved by 2030. It says that access to water and sanitation. And what government is doing for water? We have Jal Jeevan Mission. Jal Jeevan Mission. And with respect to sanitation, we have Swachh Bharat Abhiyan. Okay. So this also we discussed in your previous videos and our budget as well. So you can club those two together to have content on Jal Jeevan Mission, and we shall be discussing it forward also. But here, what are the domestic law as far as sanitation is concerned so far which has been released in India? So in 1986, there was a subsidized central rural sanitation program which was launched, okay, which doesn't stand true today. Then in 1999, a total sanitization campaign that marked from a subsidized regime. That means it catered to a bigger base, to a low subsidized one, and a demand driven approach. Okay, so it was demand driven. Then the flagship scheme that we are talking about today is Swachh Bharat Abhiyan, launched in 2014, and it was changed to Swachh Bharat Abhiyan Mission Gramin. Okay, to make India as an open defecation free by October 2019. So this was the target. So if you see what is the data with respect to these things are saying. So it is saying that between 2014 to 2019, 39% से 100% का coverage हुआ sanitation का improvement में, and that is under Swachh Bharat Mission. And when we see that post the success of Swachh Bharat Mission, the government launched phase 2, which is your Gramin. ठीक है, पहले urban में and then they launched Gramin वाला. इसका focus क्या था? Promoting solid and waste liquid management. Initially, the focus was to bring in behavioral patterns to stop littering and to have garbage bins all around the place so that you can throw your garbage there. Okay, to make the city clean. This was the first step. In the phase 2, what was added? It was added that now you want to do the waste management. First of all, you don't want waste to be littered, and then you want to manage that waste. This was the agenda of second phase. Okay, and it covering the household which were left out earlier. So its aim was to transform India from ODF to ODF plus by 2024-2025. Deadline is approaching soon. Okay. Now, if you see what is the data with respect to behavioral change, that was the data which was on papers. Now the thing is, for ODF and ODF free, you wanted to have toilets to be built in. Okay, so that everybody has access, 1 to toilets, 2 to water, so that you can use and you can actually make India as ODF free. Okay, open defecation free. That means you do not want people to go out in public and defecate or urinate, both of them. So you wanted to make India ODF free by 2024-2025. So as per the data, the government was supposed to construct toilets and encourage people to have toilets in their own home. However, now let's see the performance with respect to the behavioral change. That was data on papers, on structural things. Now, what is the change with respect to the behavior of individuals? How did it change? Whether it did change or not? Let's see. So here we have comparison in 3 years, 2012, 18 and 2020. Let's see. According to NSSO survey, 59% of rural household has no access to toilet in 2012. Okay, approximately 60% घरों के पास टॉयलेट्स नहीं थे 2012 के अंदर. और जिन बचे हुए 40% लोगों के पास थे, उसके अंदर से 4% इंडिविजुअल वर नॉट यूजिंग द फैसिलिटी. ठीक है, पहली चीज कि 60% लोगों के पास टॉयलेट्स नहीं थे in 2012. However, जो बचे हुए 40% थे उनमें से भी 4% यूज नहीं कर रहे थे इवन इफ दे हैड द फैसिलिटी. एंड द रीजन बीइंग superstructure. Okay, there was no proper structure, it was not covered. One is that, so this was a structural issue. That means you have to work on the infrastructure. Second, if they had, it was malfunctioning, it was not functioning properly. Third, the facility being unhygienic, unclean, or some personal reasons. Okay, so these were the broad parameters according to which people were not using toilets. Now come to 2018. Here we have a very short sample survey. So it is available from 3 states only, and that too they are taking 2 districts. One is the best district and one is the worst performing district. So what is according to that is 59% of households in Bihar and 66% Gujarat and 76% in Telangana had toilet access. So जहाँ पे 60% के पास नहीं था, वहाँ पे on an average you had grew to around 70%, say 65% overall they had access to toilets. Okay, now among those who having access, 38% of households in Bihar, 50% in Gujarat and 14% in Telangana had at least one member who did not use it in their house. Now समझने की बात ये है, जहाँ पे हमने 40% से बढ़ाकर we were able to bring it nearly 70% coverage of toilets, then approximately 30 to 40% of people are not used. In approximately 30 to 40% of household, there is one member, at least minimum one member is there who is not using the toilets. And the reason being, if you talk in Gujarat, the reason was lack of access of water. Now here is what comes in your Jal Jeevan Mission. ठीक है, ठीक है, tap water, but it is more related to drinking water. However, tap water accessibility and other water pipelines program are also there that are useful here. Now if you come to 2020, what happened in 2020? 27% of household in Gujarat and 61% in West Bengal did not had toilets, and this is what we are talking about, rural areas. Moreover, 3% of the household did not use their toilets in either of the states. And reason, social norms of purity and quality issues. 17% of not using toilet reported that substructure had collapsed, and 50% reported pits were full. So these are your structural or infrastructural issues. However, this is your behavioral pattern. People do not want to defecate in the home in which they are eating, and because they think it's impure. Okay, so that is why in certain villages, certain areas, people are not ready to defecate even in toilets in their own home. Okay, so they want it either to be outside the community or outside the street, or they won't do it in open. So that is the behavioral issue with respect to adaptation to the use of toilets. Okay, now let's see. A comprehensive survey was also made by National Annual Rural Sanitation Survey Round 3 2019-20, which was conducted by the ministry, according to which 95% of the rural household had toilet access in India. Across India, we had 95% of access. Okay. Access to owned, shared and public toilets was available to 79%, 14% and 1%. That means owned 79%, shared 14% and public toilets 1%. So this is the breakaway of this. Now it was also reported that 96% of toilets were functional and almost all had the access to water. However, 85% rural population use safe, functional and hygienic toilets. जहाँ पे 96% were functional and had access to water, there were only 85%. That means about 11% were not using it in a hygienic manner. Okay. So assuming the same percentage, the gap rises to 10% between access to toilets and their use. So this is what we are talking about. Understood? Now reasons क्या हैं इसके? So जिनके पास है वो 95% है, जिनके पास है but वो use नहीं कर रहे हैं वो 10% है. ठीक है? So 85% of people are actually using it in safe and hygienic manner. Now reason क्या है? The higher the household size, the greater the chances of not using the toilet. ठीक है, जितना मेंबर ज्यादा होगा हाउस होल्ड में, द चांसेस आर कि people were in the family will not be using, all member at least will not be using the toilet, because they are simply against the concept of sharing toilets. Okay, overcrowding and social norms prevent all household member from using the same toilet, correct? Now in 2020 survey 3 to 4% ही ऐसे थे जिनके पास more than one toilet था, ठीक है? That means when you are saying that 96% of the household had toilets, there were only 3 to 4% out of these 96% that had toilets more than 1%. Remaining had toilets. Remaining had only one toilet. Okay. As a result of which, the family which are larger in size are not ready to share toilets. Okay, that's another behavioral pattern issue. Then further, the chances of using are reduced if access to water is difficult. It's also found to be very high in remote and backward villages if households have doorstep access. Okay, so these were the behavioral pattern. We have seen the data with respect to usage. We have also seen the data with respect to adaptation. Okay, so this will make a very beautiful answer for your mains answer writing whenever there is a question with respect to either Swachh Bharat Abhiyan or your ODF free campaign, or with respect to sanitation and hygiene. So you can quote this data. This will be very helpful, and with respect to the schemes, they are relevant for your preliminary exam as well. Okay, now let's move to the next topic, which is how Uttar Pradesh managed to tackle the malnutrition. So the context is that they have used women, they have tried to empower the women in order to ensure the nutritional security of the children. Okay, so let's see how they have done. First, and the first foremost pillar of this drive was that they changed the entire structure from centralized to decentralized structure. Centralized means the authority is in one place. Okay, decentralized, it's in small pockets. Okay, it's not centered around one individual or one company. So what used to happen, whenever there's supposed to be a takeaway packets for food to remote areas, what used to happen, the tender was usually given to the one company, as a result of which there was a centralization of power. Here what they have done is, one, they have decentralized. What they have done, they have enroped women into it, and along with the Department of Women and Child Development, Uttar Pradesh State Rural Livelihood Mission, they came together and they led to establishment of decentralized production unit for take-home rations. Decentralized production unit, that means instead of one company, now there were multiple units in different regions, in different blocks of the state. Okay, and that too were led by women. Women self-help groups were formed who were responsible for these production of take-home rations. Okay, so 4,000 women, they organized themselves into self-help group across 43 districts. So where you had that one company, now you have women self-help group in 43 districts. Okay, so that way you can ensure the quality of the product, and that way also the wastage is also reduced. Third thing, they ensure the nutritional security by adding or fortifying the food. How? They reformulated to include high quality milk powder, oil, vitamins, minerals, aiming to support the health and well-being of children. And they also diverse and nutritional products were introduced. Certain superfoods were also introduced. So they try to diversify. One, they try to introduce healthy food, and second, they try to diversify the food options available for the take-home rations according to the region, on the basis of region also. And sometimes it was also tailor made. So it was not that one size fits all. Because they diversified, they created multiple regime for different sort of individuals or children as per their needs. So they could cater to actual need of the people. Okay. Now fourth is innovation. Now they have used app-based solution to enhance the capacities of women in producing. ठीक है, the app-based solution use किया in production के अंदर, और एक QR related pilot project start किया that will be helpful in monitoring supply chain and delivery of the packages. production, delivery, manufacturing, everything. It will be managing the entire supply chain and delivery in the market. So these were the 4 basic pillars, along with quality assurance. Quality assurance. Okay, it is accredited by the body, so they have assured the quality as well. Now, what is the impact? Okay, so first of all, it is a multi-stakeholder approach which involves collaboration between government departments, women SHGs, and international organizations like United Nations World Food Program. Okay, now statewide impact हमने क्या देखा? एक तो stakeholders multiple हैं, so you can assure the quality. ठीक है? Then statewide impact is it has expanded in 43 districts, as we discussed. 4,000 women organize themselves in self-help group micro enterprises in 43 districts. So its spread has widened, which include 202 production units and 12 million integrated child development services beneficiaries. So 202 production unit, 43 district और 12 million बच्चे. ठीक है? Beneficiaries were about 12 million. Now, अगर हम economic impact देखें इसका, तो instead it has empowered women, it has increased their source of income, and the target is to provide additional income of 8,000 per month for each woman who is involved. So now this is a way forward, an example that can be quoted in your essays, in your say for example questions with respect to addressing nutritional security, because it is a big deal right now. Nutritional security. Indian government is changing its focus now and since long from food security to nutritional security, because food security to an extent it has been able to achieve, but nutritional security is still a big deal. We still have neonatal fatalities, we still have infant fatalities, we still have nutritional insecurity. So and that too in a country which is prone to disease like diabetes, tuberculosis, cancer. So that way it is important that you ensure the nutritional security. So in that you can add this example. This will give you a very good insight to what is required. Okay, now let's move to the next topic, which is your Indian democracy at 2047 with the input from healthcare sector. See, as we discussed, the vision of India is to take a status of a developed nation by 2047. Give me a second. Vision is to become a developed country by 2047. Okay, and through the Viksit Bharat, Developed India mission. So this is the meaning of Viksit Bharat by 2047. That means India is trying to achieve its target of being a developed nation. It is still a developing nation, but we want to be a developed nation by 2047. Okay, so if you see what is the current progress so far, where does India stand at present? India has witnessed massive expansion in social economic infrastructure, entrepreneurship. Other day we also discussed about Skill India mission and the increase in number of startups, right? If you remember, if you don't, please visit the discussion. Then rural transformation and a manifold increase in number of universities and colleges, which is going to be further increased when you talk about in budget. Also we discussed the number of IITs that came up, the number of ITIs that came up, and government will also be coming up with more number of medical colleges. So this is all we are increasing. Then in terms of science and tech, we have reached we have been able to successfully land our mission Chandrayaan. Okay? And then public digital infrastructure, as you know, UPI is one of the eureka movement in digital finances and online transaction, because India was the pioneer to use UPI. Okay. Now अगर हम विकसित भारत मिशन की बात करें, so this is what India is leading the world from. Okay, so this is what we have developed so far and there's more to go. अगर हम विकसित भारत मिशन की बात करें, it represents the aspiration India को ट्रांसफर करने में to powerhouse of innovation, economic strength and social prosperity. Now if you see this particular line, this is a very good introduction. In case you get a question with respect to Viksit Bharat, say for example, do you think that India will be able to achieve its mission of Viksit Bharat by 2047? Where does India stand today? What are the steps that can be taken for India to be a Viksit Bharat? You can possibly get a question on this, and if not, it can also be asked in your essay. And if you get such question, and if you write this line, that what is Viksit Bharat means? It means that it represents the aspiration of India to transform itself to the powerhouse of innovation, economic strength, and social prosperity. So 3 pillars: innovation, economic strength, and social prosperity. Okay, it will be a very, very, very good introduction for your question. Now, the focus is to achieving health equity for all as well. Here, when you talk about social prosperity and economic strength, can it come if the people of the country are not healthy? So, health is the primary basis on the basis of which you can actually grow. If individuals in the countries are not healthy, then you cannot perform to their best potential. And if somebody cannot perform to best potential, essentially you cannot reach the best potential of the country. So it is like कि फर्क एक से ही पड़ता है. So if everyone, one by one, everybody turn out to be healthy, so they will be able to produce more and contribute more to the economy and innovation. Okay, so let's see here. What are the advantages? If we see what advantages does India have if for it to become a Viksit Bharat, and what are the challenges with respect to health specifically which might act as a roadblock in its achieving its milestone. Okay, so the advantages are demographic dividend. As we all know, India is the most highly populated country in the world. Okay, 1.4 billion, and the average age of an individual in India is 29. So India is reaping its demographic advantage. In this phase, every country has grown the max. Okay, so this is a golden opportunity for India to grow. But as we discussed, it will not be able to reap its advantage if the youth of the country, and if even for that matter the dependents on the youth, are not healthy enough. Okay, so health is the primary importance, and that is why if you see a prime minister also vouch for yoga when he went to UN, and that's where we started having International Yoga Day. So it was initiative by India. Then we also promoted Ayush ministry and the homeopathy medicine in the world. Okay, we introduce again the world to Ayurveda. So this is something that the focus of this government will always be on, and since the government is doing in all these aspects, so the chances of you getting such question, because this is the main aim, this is the main agenda, these are some of the flagship programs, the chances of you getting these questions in your exam increases exponentially. Okay, so you cannot miss out on these area. You can get questions surrounding this area either in GS or in essay or somewhere else, maybe connecting with your optionals or something else. You can get, and the probability is extremely high. Okay, so always remember, such article will enhance your answer writing skills. Then if you talk about health challenges, what are the health challenges? India is facing various health challenges by being a diabetes capital. We are diabetic capital, and there is a projected increase in cardiovascular disease. And if you have seen the pattern, we have seen that the number of heart attack, the people who are dying with heart attack in the age of 30s and 40s has increased enormously in past 10 years. Okay, in the last decade we have seen, if you take some of the famous celebrities, like they have died of heart attack, or maybe some even working out during while they had their heart attack. So it has been increasing because of the stress, because of the food habits, because of the imbalance in your sleep and work cycle, because of the stressful life that individuals are going day in day out, and many other things like smoking, alcohol consumption, that has been on increase in India. Okay, so this is another big issue, and it is again an increasing issue with respect to India. And cancer incidences, these are also on rise. Okay, again the reasons are similar. So it suggests that we need to have preventive health care, which is a lag in India. Preventive health care is extremely important, and one step that government has taken recently with respect to that was to include cervical cancer's vaccine in your immunization program. Okay. So this was one step that government has taken, but there's still a long way to go. We have to focus more on the preventive healthcare. Then technological innovations in the healthcare is again essential. Scientific research, artificial intelligence, so that individuals can address the health risk in advance through personalized prevention plans. So you need to do R&D around healthcare is required. So it has been a long-staying issue that the budget allocation with respect to health and education, these two sectors, if you talk as a percentage of GDP, although it has like grown many times if you compare numbers, but as a percentage of GDP, it is far behind than the developed country in the world, like your US and China. Okay, so if you see them, let's see what is the opportunity. India, first of all, India is a location for people to come here. The pharma industry in India is extremely big. We have been supplying medicines, we have been supplying vaccines to other countries. People come to India from like our neighboring countries, from Afghanistan and other countries, for specifically for medical services. So that is one area. Again, India is strategic hub for medical value travel, offering high quality clinical outcomes at a fraction of global cost. And one of the major reasons is it's cheaper medical services in India. Okay. So this can play a big role in creating employment and thus earning foreign exchange, economic increase for the country. So we need to focus more on the healthcare. Both preventive and palliative healthcare is essential. So India stands as a pivotal moment in healthcare, and we need to reimagine by AI-driven healthcare solutions. It needs a lot of R&D to be put in, coming out with these innovative combinations and combating non-communicable disease like diabetes, cancer, cardiovascular disease. So, which are growing in India at a large scale. Okay. Now this is the last topic, but a very important topic for the day. This is your Myanmar Civil War and India's interest. So what is happening since 2021? Okay, there was a military coup in Myanmar, which led to the removal of elected government of Aung San Suu Kyi. Okay? And till from February 2021 till today, there is a military rule in Myanmar. Okay. However, the military at that time thought that the resistance against their rule will be short-lived and people will eventually settle down. However, it has been growing till then, from then, and what is happening? There are a lot of ethical conflict also which are arising as a result of this. Many ethical bodies, like organizations, like ethnical armed organization and People's Defense Forces. Now they are also controlling many towns as of now. And in the recent development, which has been an important concern for India as well, is that the Arakan army has captured Palitwa in Chin state, which lies on the Myanmar western borders with Bangladesh and India. This we shall be seeing in a map. अब कर लिया कॉन्कर तो उससे फर्क क्या पड़ गया? The फर्क is, the difference is that it has altered the dynamic between Chin and Arakan ethnic group. तो ये जो ethnic issue चालू हुआ है, start हुआ है म्यांमार के अंदर, that is an issue for Myanmar as well as for the stability of the region as well. So let's see. if you see the demography क्या कहता है? It's a commercial town on the Kaladan River, and it is associated with your Kaladan project. We shall be discussing. So the majority of residents here are Chin ethnic community, and they use their town as integral part of homeland. ठीक है? So do you understand what is getting here? What is going here? There are two type of war. A war which is going against the military in the Myanmar, okay, because they acquired they removed the elected government and established themselves as the government, okay. The second is there is an ethnic conflict which is going on, ठीक है. The resident of Arakan, which is also referred to as Rakhine state, they say that this township was historically a part of Arakan hill tract, this Palitwa. So they are also claiming that this belonged to their hill tracts, okay, and there was a part of their province. So they are trying to capture this province. Under that, they are saying, they are claiming that the province is part of their province, okay. So in the recent past, Chin armed groups and the Arakan army has been fighting. The Myanmar military, they had refrained forcefully. So far, they had refrained to fight among themselves because they were fighting, but now there's increased tension between these two groups themselves. So, what is the need as of now? The need is that they have to give up the ethnic conflict between themselves, and they along with the other ethnic group of the country should give a single front war to the Myanmar military in order if they wanted to have a elected government in the center, else the military regime will continue. Okay, so what is the issue? If we talk about India's take, so Indian government has this Kaladan multimodal transport project, okay, in Myanmar, which was envisaged in 2008, and it has been delayed significantly since then. The Kaladan project was aimed to address the geo-economic, geopolitical challenges of the northeast India as transporting goods to and from northeast via the narrow Siliguri corridor. And the reason why, because the presence of China there and the terrain is also rough, so the transfer and the goods and services from the Siliguri corridor is expensive also, and it is very difficult also. And in terms of strategically, it is important that you also have a second access to northeast rather than just one access, because if anything goes wrong between Bhutan and China can directly come to that area. So in order to have strategic balance also, you need to have a second way to reach there. Okay, so this was conceptualized as alternative route, the route that give northeast access to India, as we discussed. Okay. Now see this. This is the map. Here you have Kolkata. Then this is your Myanmar, and this is your northeast. Okay. See this from here. We are. Just give me a second. So from Kolkata to Sitwe, this is your one route, which is shipping by sea route, and then from Sitwe to this Paletwa, this is the town where you are facing the conflict at present. Okay, so here you have inland water transport. Okay, and then Paletwa to Indo-Myanmar border in Myanmar. Till here, yahan tak, you have a roadway. And then the minute you enter in India, this also is going from here to here through road. So this is your Kaladan multi-modal transit. Okay. So this was conceptualized by India. However, it has faced significant delays. It was conceptualized in 2008, and it has faced significant delays due to rugged terrain, non-cooperation and instability in the region. Instability in Myanmar. So these are the issue for the delays. However, if you see the current crisis which are going in Myanmar, if you consider that it is also considered that these ethnic groups are the military, and these Arakan group is actually against India's interest of these construction. So they are not against, you can say, but they are not in favor also. Okay, so they are not towards India. Okay, so this is another issue with respect to India's interest. So as we discussed, rugged terrain, inadequate interdepartmental coordination, political insecurity, and stability charges. Sitwe Port inland water terminal has been completed in the past few years. Road construction is facing challenges due to security situation in Myanmar. Okay? So, and these people, the Arakan people are not happy. They are not happy for these construction. So this was the challenge with respect to India. If the ethnic conflict grows on, so it will not be a good sign for India. Also, since we are sharing the border, the chances of conflict reaching in our area is also increasing, because we do not have fenced border as of now. As a result of which, if you know, that recently government has also taken away the free movement regime. So you know, right, we had a free movement regime with the free movement regime. See, the conflict is going in this area, and these are our border with India. So it is possible that you can see an infiltration in our region as well. And as a result of which, the government has cancelled the free movement regime also, because there were a lot of voices coming from Manipur and other states that they are not. It is leading to increasing number of refugees to the India. Okay, so that is why this problem is important. If the region needs to be more stable for India to have peaceful existence in the region. Okay, so this was it for today, and if you have any other question, you may please ask in the comment section below. Thank you. Have a nice day.